Hi, my name is Mandy, and today I will be talking about the breastfeeding challenge of feeding a hypoglycemic newborn with a decreased milk supply. Some things I'll be talking about include what it actually means to be hypoglycemic, some maternal and newborn risk factors for hypoglycemia, causes as to why milk supply may be decreased, some things to look out for such as signs and symptoms of hypoglycemia in the newborn and normal intake and output for the newborn, making a judgment about what could be happening based on observed cues of the mother-infant feeding dyad, describe 3 priorities for this challenge, explain treatment and nursing support, and how to evaluate the effectiveness of our care. First, hypoglycemia basically means blood sugars that are less than adequate to support bodily functions, and this is a no-no for newborns. Typically, newborns accumulate glycogen stores in their liver in the third trimester to prepare for birth and extrauterine life. These stores are then available to them in the immediate postpartum period. However, the enzymes needed to convert glycogen into usable glucose is not functional at birth, so sugars will be their lowest in the first 2 to 3 hours after birth and slowly rise as the enzymes become functional. So there are some risk factors for hypoglycemia in the newborn. So first, large for gestational age. This means greater than 4,000 grams at full term. Small for gestational age. This means less than 2,500 grams at full term. Prematurity, just because that means they don't have enough time to accumulate the adequate amount of glycogen stores. Unwell babies under extra stress, so cold stress, sepsis, jaundice, if their APGAR score is less than 3 at 5 minutes after birth, presence of endocrine abnormalities, and also delayed feeding. Some maternal risk factors include maternal diabetes, smoking, hypertension, anemia, retained placenta, dehydration, and medications that affect glucose status such as tocolytics. So that's just half of the equation. Let's talk about some causes of a decreased milk supply. First of all, milk production is based on supply and demand. That's pretty explanatory. The more milk that is used or emptied from the breast, the more your body will make. Sometimes things don't always work out the way it's supposed to. Say the baby needs milk and we are feeding him, but we don't know when he's full, so we end the feed early. This means that demand is incorrectly lowered, and that will affect supply. Other things that affect the supply and demand scale include breasts not being emptied completely at feeds, feeding from only one breast at a time, supplementing with formula, or feeding on schedule instead of on demand. Often, a decreased milk supply is due to feeding issues rather than primary insufficiency where the body isn't producing enough breast milk because of a physiological deficit. Some other causes of decreased milk supply that's unrelated to the supply and demand scale and more geared towards primary insufficiency include insufficient growth and development of breasts, insufficient glandular tissue, breast reduction surgery, hypothyroidism, retained placental tissue because that may alter the normal hormonal shift after birth, Sheehan syndrome, inadequate hormone levels, delayed skin to skin, anemia, and maternal stress and fatigue. Here are some signs and symptoms for hypoglycemia. Abnormal level of consciousness, irritability, lethargy, stupor, abnormal vitals, so tachycardia, tachypnea, if they have a low temperature, abnormal cry, so this would sound high-pitched and whiny, hypotonia or limpness, tremors, poor sucking, diaphoresis, and if it's really serious, seizures. And sometimes they can be asymptomatic. So in this case, you would need to do a blood sugar, and a normal newborn's blood sugar is greater than 2.4 2 hours after birth. Other ways to tell if an infant is getting adequate nutrition include looking at the number of feeds a day, the number of voids a day, and the type of stool. So a baby should be fed anywhere between 8 to 12 times in a 24-hour period. And this should be done on demand and not on a schedule. Sometimes the baby will give clues as to when they're hungry. Some of the feeding cues include hand-to-mouth movements, sucking movements or sounds, soft cooing or sighing sounds, and in the early newborn, just being awake is sometimes a feeding cue. So the reason why a newborn is being fed so often is because of the size of their stomachs. On the first day, the size of their stomach is equivalent to the size of a chickpea. From days 3 to 5, it's about the size of a cherry. And from days 7 to 10, it's about the size of a walnut. So a newborn's output should look something like this. On the first day, there's 1 void and 1 bowel movement. On the second day, it's 2 for 2. And on the third day, it's 3 for 3. Then it varies after that from between 6 to 10 wet diapers a day. Basically, every time you feed a baby, you should get a wet diaper. And stools change from a green-brown meconium to a mustard seed yellow by day 5. Babies should return to their birth weight by day 14, and they should gain about an ounce a day for the first 3 months. In order to figure out what is really happening, you're going to have to observe a feeding session. So the first thing you'd want to look for is whether the latch is effective or ineffective. So an effective latch, the baby would have full rounded cheeks. They would suck quickly with short rest pauses. They would have audible swallowing and gulping sounds, and they would not be easily pulled away from the breast. An ineffective latch, the baby would fall asleep because their sucking reflex is not being stimulated. They squirm and pull off the breast easily with no resistance. Clicking and smacking sounds are heard when they are feeding, and the nipples are pointed instead of rounded after a feed, and there is significant nipple pain for the mother. You'd also want to ask mom how often she feeds, how many wet diapers she changes a day, and what kind of cues the baby gives her to let her know that they're hungry. You would also want to see how the mom feels, how her breasts feel, like if they're full after feeding, and what she does when they are. So basically, you just assess for all the things that allow you to conclude that the baby is being fed adequately. My 3 priorities for this challenge include assessing the newborn for continued hypoglycemia and working to resolve it, assessing for and filling any gaps in knowledge that the parents may have, and talking to the parents about the 3 E's and the 3 rules of breastfeeding. So the 3 E's of breastfeeding is early and often, effective breastfeeding, and exclusive breastfeeding. And the 3 rules of breastfeeding are feeding the infant, moving the milk, and ensuring that the mother-infant dyad is feeding effectively. These 3 rules help to prevent most breastfeeding problems, and that's why they're important. So for treatment and nursing support, the first thing we would want to do is a thorough assessment to figure out why the baby is hypoglycemic and why the mother is having a decreased milk supply, and then treat with the appropriate interventions, which can include some teaching to fill any knowledge gaps that the parents may have, suggest increased pumping or hand expression, and spoon feed if the baby is not latching or breastfeeding well. This also helps to increase the milk supply. You can suggest the milk bank if the mom has primary insufficiency. You can also provide resources such as breastfeeding clinics in the area, mommy support groups in the area, or breastfeeding support groups in the community. Also make sure that the mom does not blame herself for the baby being hypoglycemic and provide emotional support as necessary. You can also make a referral to a lactation consultant as necessary. You can also make a referral to a pediatrician if the baby's hypoglycemia doesn't resolve with increased feeding and you determine that there's nothing wrong with the latching and intake of breast milk, because then it could actually be something physiological and the pediatrician would have to run some tests and figure that out. They may order a glucose infusion to help increase the baby's blood sugars. I would be able to evaluate the effectiveness of my care based on the resolution of the baby's hypoglycemia, if the baby is gaining weight, if the parents can explain to me the importance of the 3 E's and the 3 rules, if the parents have any further unanswered questions, and basically based on how the parents are feeling. In conclusion, you want to remember the maternal and newborn risk factors for and signs and symptoms of hypoglycemia, the 3 rules of breastfeeding, and making sure that the mom doesn't blame herself and she is emotionally stable or she has the adequate supports to make sure that she is okay.